Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I know there's a lot of confusion around the BUN creatinine and estimated GFR because I get a lot of questions, and I'm going to try to clear that up as best I can today and give you sort of a quick primer on how to look at these tests and what to do about them next. Well, the GFR, the estimated GFR, is a complex formula that takes into account many risk factors: serum creatinine levels, which you see, age, sex, and race. And there are more than one formula that labs use to calculate that. So it could lead you in perhaps a wrong direction. However, an abnormal GFR with normal BUN and creatinine levels. Now, I've heard this many times. Why? What does that mean? Well, you still need to pay very much attention to it because it can sometimes occur due to several reasons. And I'm going to give you a few and possibilities and correlations for yourself as a clinician, what to do. There is a variability, first of all, as I said, in equations. The formulas used to calculate rely on serum creatinine and the other factors we said. They're different equations. They might yield variations from one equation to the next. And it's influenced by demographic factors, which include age, sex, and race, which might not fully account for the individual patient characteristics, and that's where you come in. Because creatinine is a byproduct of muscle metabolism, individuals with low muscle mass may have lower creatinine levels. The estimated equation might underestimate the kidney function. Similarly, dietary intake can affect the BUN levels as well. So dehydration or overhydration can affect the BUN and the creatinine levels and therefore influence the estimated GFR indirectly. Now, if an estimated GFR is not normal, then you should approach this methodically. And the very first thing, which makes all the sense to me, is repeat the testing. Hydrate the patient, do what you think is appropriate, and confirm if that initial GFR was abnormal, especially if it's inconsistent with your patient's picture. Make sure you did a complete medical examination and ask the right symptoms and history questions like edema, fatigue, or other changes in urine output that could affect kidney function or suggest kidney dysfunction. Consider risk factors in these patients. Do they have diabetes? Do they have hypertension? Do they have a family history of disease or a nephrotic type of toxic medications? There are many of them, and you can look them up, of course. Review other kidney function indicators like serum creatinine, BUN, and the electrolytes, and check that urine for proteinuria and or hematuria. It may lead you into a proper understanding. And if you're still not sure, you can always check Cystatin C, that's Cystatin. It's a blood test, and it will give you a little more comprehensive assessment because it's independent of muscle mass. And if you think that may be an issue, that may be a test that would be appropriate for that individual. Evaluate the patient's hydration status and the dietary factors that can influence these test results. And if you're still unclear as what you have after you do some serial evaluations and check these things, you might want to refer that particular patient to a nephrologist for a further evaluation. But if you're going to watch this patient, implement some sort of monitoring schedule to track these kidney patients' function over time, and which should involve periodic estimated GFR. A complete metabolic profile has it in it. And begin to address underlying conditions, of course. Control the blood pressure, control the diabetes, modify lifestyles, diet, and hydration, and, based on whatever other medical advice that you may have for that individual. And adjust or discontinue medications that you believe are nephrotoxic and or have you looked up and seen them. I think this should help you in generally understanding when you get back a complete metabolic profile, the BUN creatinine and the eGFR. Look at all three. think about them in context to what we just talked about. I'm hoping that's going to help you. I'm Dr. Mitch. If you need any further information, you can always contact me or write to me by writing to Dr. Mitch, DrMitch, at mitchgen.com. That's MITCHGHEN.com. Thank you so much for watching. I hope this was helpful for you.